Pedro Vicente Maldonado lies at the Andean foothills of Ecuador. Rural and remote, household incomes average less than $4 a day. And yet at the local hospital, all patient histories are recorded digitally in a paperless environment.
We've been ahead of the curve from the very beginning, keying all patient data into a centralized medical record on software we wrote ourselves. This lets doctors and nurses share critical information in real time.
This is true quality healthcare delivered to a vastly underserved population, and that's the mission of Andean Health and Development.
My name is David Gauss. I'm a physician, and I founded Andean Health and Development 20 years ago.
He was supposed to be an accountant. Instead, after graduation, David volunteered in Quito, Ecuador, and discovered his life's mission. He would become a doctor, studying tropical medicine and public health at Tulane, so that in 1997, along with his mentor and co-founder, Father Theodore Hesburgh of the University of Notre Dame, he could launch Andean Health and Development in a 400-square-foot storefront clinic.
That was where I actually really learned what it was to practice medicine in a rural community in a country where the healthcare system does not function properly for the poorest of the poor, over and over and over again. I saw the despair of the people, and that's when we realized we didn't need just an outpatient facility, we needed a full hospital.
But simply building a hospital was never the goal. The real goal was to make that hospital locally sustainable.
Early on, as we were searching for financial self-sustainability, we experimented with all kinds of methods to get there. We made every mistake possible.
So David had this idea that you could have sustainable healthcare in rural Latin America that did not require constant infusion of dollars from outside the country. And everyone thought he was crazy. But he turned out to be right. He tried rural insurance programs, didn't work. He tried partnerships with companies, didn't work. And he just kept knocking on doors until he found a constituency that needed the services in addition to the people in the community. And PVM has been 100% self-sufficient because they wouldn't be overwhelmed by failure and because they never lost their dream.
We are a very lean organization. I am the only employee here in the United States. All of the staff at our two hospitals are Ecuadorian. So we work for and with the communities we serve. And we don't look at the Ecuadorians as the recipients of charity, but instead they're major players in their own story of development.
AHD's commitment to developing local resources has attracted the attention of global health leaders like Ronald McDonald House Charities.
Andean Health and Development has many, many great qualities that make them just a leading organization. Its commitment to building infrastructure in country, working side by side with people in Ecuador to define issues, to define the solutions, and then to make those solutions a reality.
Fundraising and charitable grants are critical to launching and supporting AHD's efforts.
When it came time to build Hospital Hesburgh in Santo Domingo, the Weinberg Foundation helped us buy the land and also cover much of the construction costs of the hospital. We're very proud of that.
Their first hospital in Pedro Vicente Maldonado achieved sustainability in 7 years. Hesburgh Hospital is on track to reach that in 5. But even success can bring challenges.
We couldn't get enough doctors.
Las dos principales escuelas de medicina de la ciudad de Quito forman médicos para trabajar en la ciudad.
Necesitamos seres humanos que entiendan que la ruralidad es diferente y que la ruralidad existe y no está abandonada.
And so in a country where less than 15% of all doctors receive residency training, Andean Health and Development established Ecuador's first residency program for rural family medicine.
Between our residency program, our clinical manual, and our online journal, we've reached physicians way beyond Ecuador. Mexico, Colombia, Peru, Spain. Each month, we receive approximately 7,000 visits to our website. Creating a platform for spreading education is a game changer.
As they enter their third decade, Andean Health and Development straddles the intersection of clinical practice and public health. They've advanced rural medicine with an entire healthcare system and influenced global health policy with a fresh, much-needed perspective from the Southern Hemisphere. And yet their most immediate impact is transforming the lives of the people they serve every day.
PBM and Santo Domingo have been fundamentally changed by the work we do. Because there's a stable healthcare system or hospital in these communities, kids miss fewer days of school, employees miss fewer days of work. Being able to take care of people in their own space makes a fundamental difference in everything from education to wages to stability of communities.
You know, really in the end, that's what it takes. It takes people believing in something. It takes people recognizing that they can be part of something bigger than themselves, that they can actually change the world. It's possible.